Well, I was seeing a young child who had megarectum, um, and he had incontinence, and it was really horrible for him. He tried a number of different things, and in the one of the interventions that they gave him was an appendicostomy, so a tube that goes through the appendix. So basically, he could flush out his bowel, and I believe there are other sort of procedures as well where they do the same thing as a way of managing constipation and fecal incontinence, etc. Are they things that your center does a lot of, or again, not
Yeah.
necessarily?
So first of all, we talk about a very, very small group of patients with constipation. So it's the far end of all those children. So I think it's less than 1% of all cases, because many of these children are treated by the general practitioner or the general pediatrician. We never see them. And I think that's a very good question, although difficult to answer, because your question is also, when do you do a surgical intervention, and what kind of intervention do you do? So some people favor to do it a Malone, appendicostomy. And I think that it only helps in those children who are helped by colonic irrigation through the rectum. So if you are successful in helping these patients and they are totally fed up with this kind of treatment because they don't like to stick it into their bottom, etc., then it is probably a very good way to use a succostomy in these children. Although you have to be honest, because there are many complications with this kind of therapy, because it can be painful, there can be leakage, all kind of things. But for children with constipation and spina bifida, it's perfect because it always works. But in those children with outlet obstruction, for instance, in functional constipation, in many times, in my experience, it doesn't work. So it's not worthwhile to do such an operation. So yes, in some children we do it. If in those cases they're fed up with their colonic irrigation and it's very, but in the slow transit constipation, for instance, I never do it because I don't find it favorable.